Collaboration is central to DPU's ethos, and our overseas practice engagements are equally central to our master's programs. The OPEs engage with specific overseas partners and are designed to help us work collaboratively to understand and look for solutions to many of the dilemmas of development planning. In other words, the OPEs help ground more conceptual discussions in reality. Each OPE uses a range of tools, including live and asynchronous online discussions and tours, group work, and, where possible, physical travel. Of course, the COVID-19 pandemic has changed the mix of approaches, with a greater emphasis on online engagement, but the objectives remain the same. Across our 7 MSc programs, each places the OPE at the core of our teaching, though each also employs slightly different focus and methods to reflect the different topics. However, there are common themes across all of the programs around social, spatial, and environmental justice, and the ways those can be connected and hopefully enabled through development planning.
All of our OPEs are sort of grounded in this idea of action research. And action research means that you're not just observing a scene, you're actually engaged in, partnered with an alliance of actors working for transformative change.
It's so much about ensuring that we really place those who matter, those on whom data is collected, are really brought to bear within the center of the entire research process.
We worked in a neighborhood called Moravia, which has been kind of a paradigmatic case of slum upgrading in the city of Medellin in Colombia. So it's in that context that action-oriented research becomes very central.
We try to understand how to organize collective activities. This is the only way for us to understand what the aspirations of local inhabitants and local stakeholders in general are.
Based on priorities identified by communities and their partners, our students formed teams with Indonesian students, and each team worked with an organization of persons with disabilities, supported by the NGO Kota Kita. This allowed the students to start from the problem identified by communities and reflect with them on strategies for action.
Co-production is when there's more than one person involved in conducting research.
We mean a shift beyond mere collaboration towards joint problem solving.
Academicians, researchers, practitioners, and also the local community coming together to investigate or to research about a certain topic that can lead to the betterment of lives of people in the community.
Knowledge co-production is a process to develop and co-produce knowledge as the core of a meaningful learning experience between students and communities.
Co-producing research is an opportunity for us to bring in different actors with different knowledge bases and different perspectives.
Meaningful knowledge about development issues in the Global South cannot be solely produced by academics based in the Global North.
When we try to speak about knowledge co-production, I think we also need to highlight how our own privileges and our positionality shape those relationships.
How we frame, how we understand places, and therefore strategies to address and change and to foster change in some places is very essential to know what are the different ways of knowing and the different interpretations.
So in the context of the OPE, knowledge co-production is basically about expanding the team that is doing research.
We have worked together, especially in terms of issue definition, but also in terms of setting the research agenda.
Everything was done from the very start of the process in a dialogic manner, so that is already a co-production example.
We find the co-production of knowledge in the Zoom discussion within the student and the community.
And there were several tools that we used for online interactions, be these specific ways of formulating the conversation in order to be inclusive.
Partnerships with equivalence recognize that different partners bring different contributions and recognize the different resources, capacities, and inequalities of partners.
Partnership with equivalence is a partnership where all the parties involved have an equal opportunity to voice their ideas and approaches to research.
For us, it's manifested as a continuous, equal, and open process between partners to successfully achieve the goals of learning process.
If you're partnering with someone, you're going to be sharing information with them, you're going to be sharing knowledge, you're going to be developing together.
We have same value, same position on this process.
But then it's so much about moving beyond collaboration to establishing trusted relationships.
It is something that is worth to be explored for the partner organization and of value, not just for that organization, but also for other stakeholders.
We were sharing the stage with our counterparts, with an organization that is like-minded.
Each partner have equal roles, leverage their strengths, and continuously offer feedback to the process.
The overseas practice engagement builds on this close relationship. The partner is able to speak freely beyond power relations.
Throughout this process, it's important to always reflect in action to understand your assumptions that you bring to the table, and also how the different actions and your presence there has an influence on power dynamics, on local context.
My understanding of reflexivity has evolved during the course of the program.
So it's my ability to identify and examine my internal compass and to understand my biases and how that might potentially affect my research.
We have kind of consciously put that reflexive understanding in the field.
A big part of it for us on the staff side is to work with students to constantly reflect in action, to understand how their presence is impacting on the processes they're observing, and then how to manage that space.
I deliberately or consciously think about my biases, my assumptions.
There are some more rigid kind of positions that affect your positionality around, your age, your gender, etc. But then there's more fluid components. So things around like your political views, your environment that you may have been brought up in, how does that affect how you view things?
I had to rein myself in at times and tell myself that I need not necessarily have information which is relevant to this particular context.
What was very important for me was to constantly have an open attitude towards this new form of learning.
So I think like just being very aware that, certain things can trigger the way you think of things and kind of clearing that away so that when you go into a project, you're very much objective around what's happening.
In terms of power dynamics, there were just so many actors involved. In relation to each and every one of them, there was a different kind of power imbalance.
I think what we kept in mind was proper communication and empathy.
Each time I had to just think of myself as to, is there a power imbalance? How might I foster a space which is more conducive to them sharing their perspective?
I think I just, maintained the same level of, being welcoming, being respectful, listening to everyone's views. And I think that was important because the dynamic of what's happening on the ground doesn't necessarily affect the way that I should engage with individuals.
So for me, an ethics of care, I think, is really a principle of practice.
Ethics of care means taking ethical concerns much more than their formal ethical permission and approval process.
Having an ethics of care is really about kind of actively checking in with people, making sure that people are okay.
We've been, in a way, moving across not only social unrest in the place that we work, which causes direct impact and stress on our partners, but also a deep sense of loss given to the pandemic. So how you set up, a secure environment to actually work together.
The aspect of care was kind of all the time present in this research, either for the participant or also for each other, like our research group.
So somehow we had to set up moments of debriefing, of acknowledging, or mourning.
Setting a set of principles at the beginning helped trying to have this sort of community instead of just, colleagues.
It was really important to kind of understand, what was happening and affecting people in their personal lives.
You were engaging with the same way with people that were 5 blocks away from you, that from people that were in Indonesia, and you were 9 hours away.
So we had to be very conscious of, when are people out of work? What was the best time for people to work? We had discussed that our mental health and well-being would also be like a top consideration.
There was always a discussion on how to make such activities not harmful for the current well-being of the local participants.
Like the DPU students and DPU lecturer always, they are not only asking a lot of questions to the community, but thinking about how to give back.
The field is the field, and that's where the actors and the households and all the stakeholders are based.
It's about going to the real world, and it's about working with real people about the conditions that they live in and that they're facing, and it's about learning.
What's changed is the way that we engage with the field without being able to travel to the field.
With COVID, it's now very clear to us that even without going physically, it is still possible to learn, it's still possible to collect data, and it's still possible to engage.
So by field, probably I want to highlight it not always mean as a geographical space with coordinates. Rather, field is more dynamic and relational. And this was more, we realized that when we did this remote field work, when the boundaries, geographical boundaries transcend different times and space.
The field, I think, the notion has been really one that has been reconceptualized, especially in terms of our engagement within the OPE.
We have learned to leverage those digital tools, obviously, and they've come extremely useful. But it's also affected the relationship with our partner organizations, whose role became even more integral to the OPE itself, because they are based there in the field.
In a way, the partnership that we've had established with the local organisations that we work with has had to become even more equal.
In a way, it has changed the power relations because our partners in the Global South now have much more power as well as responsibilities.
There was a lot of rethinking, but I think it also opened up quite a lot of opportunities.
We were able to work in two different cities which are very far from each other, and we think that this is the direction which our work is going to be in future.
Thinking through those moments where we come together and building that into the research design has been really interesting.
The pandemic has also taught us that we are more digitally dependent than ever. And so there is no point that we are trying to limit our digital engagement.
Having to conduct the OPE remotely has definitely pushed our boundaries to be innovative in connecting and understanding situation in the field.
The COVID-19 pandemic has in many ways accelerated the broader shift to digital means of higher education.
I think we should look forward to bring an integrated methodology which includes the digital or remote engagement as well as also the bodily presence in the field.
One of the exciting things will be to find ways in which people operating at community level can increasingly become part of the documentation.
The way in which we teach in the future will unavoidably retain some degree of online format, which will be imperative for equipping our students with the competencies needed to engage in an increasingly digital world. It is our intention that the overseas practice engagements will provide the DPU with a basis to address this and other major global environmental and developmental imperatives through our teaching, research, and practice in the 21st century.